Effectiveness of multimodal chiropractic care featuring spinal manipulation for persistent spinal pain syndrome following lumbar spine surgery. Retrospective chart review of 31 adults in Hong Kong. The term persistent spinal pain syndrome type 2, PSPS2, has been proposed by the International Association for the Study of Pain to replace the term failed back surgery syndrome. This retrospective study aimed to evaluate effectiveness of multimodal care featuring chiropractic spinal manipulation, CSMT, in 31 adults in Hong Kong with PSPS2. We identified new adult patients with PSPS2 receiving CSMT from 2016 to 2018. Demographic and clinical data and baseline follow-up numeric pain rating scale, NPRS, and Oswestry Disability Index, ODI, scores were extracted. Multiple linear regression was used to examine post-treatment NPRS and ODI reduction, with clinical variables as covariates. Of 6,589 patients with low back pain, 31 met criteria, mean age 52. Surgeries included laminectomy, 81%, discectomy, 13%, and fusion, 6%. Patients received spinal manipulation, 100%, drop technique, 81%, passive modalities, 65%, soft tissue manipulation, 13%, flex ion distraction, 13%, and mechanical traction, 13%. All patients had a minimum clinically important difference for NPRS, 32/10, and ODI, 330%. 1 year after treatment, 48% maintained improvement, 42% experienced recurrence, in 10%, follow-up was unavailable. Regression analysis identified younger age, shorter symptom duration, and greater baseline NPRS as predictors of NPRS reduction, and greater baseline ODI as a predictor of ODI reduction. Patients with PSPS2 improved with multimodal care featuring CSMT, which was more effective in patients with younger age, shorter symptom duration, and higher baseline pain or disability levels. This case is published at Medical Science Monitor in 2022, and indexed at PubMed.